Tzu Chi volunteers on the outskirts of Zimbabwe's capital care for the poor during the epidemic. Dalin Tzu Chi Hospital celebrated 20 years by reaching out to seniors and the poor in various areas. I'm Sean Scanlon. This is DI Headlines. Let's get started. 30 kilometers away from Zimbabwe's capital is a town whose residents are mostly handicapped or those who have been hurt in work accidents. Tzu Chi volunteers worried that the residents of this town wouldn't have enough to eat during the epidemic as they worked with the provincial social welfare department to host a distribution.
In this abandoned livestock structure lives two people who are in need of help. Judith suffers from mental illness and was abandoned by her family. Thankfully, Zachariah Kamwina has taken her in, and the two rely on each other to get by. In the small town of Chitungwiza, impoverished families like this one are common.
I had measles when I was 6, and my parents didn't take me to get treated at the hospital. Instead, they chose to use herbs to treat it, which didn't work, and it led me to become blind.
Teaching them how to use personal protection supplies, the volunteers also distribute food items to ensure they don't go hungry.
The aid distribution this time is aimed at those with disabilities. We're working with provincial social welfare, and so our distribution is a lot easier now.
Here in Chitungwiza, there are a lot of people with disability, such as the blind and deaf. I am grateful Tzu Chi has decided to come here to distribute food and helping the residents.
No matter if they are blind or deaf, the recipients make sure to come and receive the aid items personally. And thanks to Tzu Chi for the assistance.
I am so happy to receive aid items, especially since I'm blind. It's hard to be allotted food at times, and now with the quarantine period, it's even more difficult. Thank you for giving me food and cleaning items.
10 kilograms of rice, cooking oil, soap, and masks. These aid items give over 500 families a ray of hope.
In the United States, the COVID-19 epidemic continues to ravage the country. The Tzu Chi Washington, D.C. chapter began implementing a mid to long-term relief plan in July, cooperating with NGOs to distribute food to low-income families in many communities. Tzu Chi Washington chapter is implementing a mid to long-term epidemic relief plan. Starting in July, food distribution has been carried out one after another. Great detail paid to packing supplies.
We pack the food for the families, the beans, the spaghetti sauce, and corn for all the families who don't have food.
In this community in Virginia, Tzu Chi volunteers contacted Dr. Nguyen Dang Lam Song, a Vietnamese national, more than a month ago. They later became partners in this food distribution.
He said that most of the patients he treats here are low income and need help, so we planned this food distribution with him.
This COVID-19 pandemic, it has hit a lot of families very hard, and we are doing our part to work with this wonderful group to help out our community.
Volunteers provide food and daily necessities and promote the concept of vegetarianism, along with the concept of donating a little money for a greater cause. Many people are eager to try this.
It's a mango bag, all those is come from this. So hopefully you contribute a little every single day, and that day in August, September, you bring this back to us. This is the address, and this is all the donations for this. You have chance to help other people.
Another distribution saw Tzu Chi volunteers cooperate with the Washington, D.C. Community Service Center. Tzu Chi provides dry goods and the center provides fresh fruits and vegetables. Each family can receive approximately 30 kilograms of food in stock.
I thought this would be a real good opportunity to expand into a whole new group, because at the time my food supplies were a little bit short, and when you offered to put boxes together, I thought, okay, let's make this happen.
In order to prevent the spread of the epidemic, the distribution was carried out in a speedy manner. The original plan was to take 2 hours to complete the distribution. It only took half of that time. Although the epidemic has required everyone to observe social distance, there's actually no distance that can stop the spread of love and compassion for neighbors and community.
In Qingdao, a 70-year-old senior has a pair of children with mental disorders. He is in poor physical condition and has to take care of his children alone. In November last year, a government official referred his case to Tzu Chi, and volunteers began to care for them. However, because of the epidemic, volunteers didn't visit them for half a year. This time, they cleaned his house and taught his children how to take care of themselves.
It has been more than half a year since the last time the volunteers came to visit. After the epidemic eased, Tzu Chi volunteers came again. Senior Huang and his pair of children were happy to see them.
Because his elder son has mental disorders, he didn't wear clothes. We first coached him into wearing clothes. After he wore clothes, we communicated with him about our purpose today, and he eventually understood and left the house. Then we started cleaning.
The children of the 17-year-old senior Wang inherited mental illness disease from their mother. Tzu Chi volunteers began to care for them since November last year through government officials. Originally, they planned to visit senior Wang once a month, but later it was cancelled because of the epidemic. They only resumed the visits recently.
My colleague asked me to come over to join this charity event 2 days ago. As I always want to care for others, I came here. The situation is a bit beyond my expectation, but we must work hard to clean up. I also hope to have the opportunity to participate more in the future.
Apart from cleaning, volunteers also taught senior Wang's children how to take care of themselves, making up for the maternal love they have lost since childhood.
Every Tzu Chi volunteer is helping, no matter if it's in cleaning or helping the two disabled persons. The volunteers also taught them how to be self-reliant and manage their emotions. I have really benefited a lot. I also hope to have more opportunities to join this kind of event in the future.
Giving senior Wang the nutritional supplements and friendly advice, it is hoped that the life of the Wang family will get better and better.
For several days, there was heavy rain in southern Malaysia, causing flooding in Negeri Sembilan, with many homes damaged. Tzu Chi volunteers visited 53 flood survivors and gave them emergency supplies.
Due to heavy flooding in Negeri Sembilan, Seremban, and Port Dickson City, residents are busy cleaning up their community.
Around 7:30 a.m., water started flooding into the house. There wasn't enough time to move our furniture.
40 households were affected by this incident. Clothing, furniture, electronics, refrigerators, and televisions were damaged.
There was still heavy rain when Tzu Chi volunteers arrived, but emergency supplies were still given out, aiding 53 households.
On behalf of all the residents of this village, I would like to thank Tzu Chi. Our burdens were relieved since the volunteers visited.
Thank you for coming, seeing the volunteers at the village in the past few days. I'm very touched. Your help is very much appreciated.
While visiting local residents, Tzu Chi volunteers promoted the bamboo coin bank, hoping to inspire residents to make daily donations for a good cause.
It's the 20th anniversary of the establishment of the Dalin Tzu Chi Hospital, and healthcare workers formed 10 groups and headed into various communities in southern Taiwan to look after seniors. Let's take a look.
Visiting this 96-year-old senior who is blind in both eyes since young, Dr. Lai Ningshen discovered the granny has pus in one of her eye and immediately treated the problem, while asking her family members to get it further checked out.
It's been 20 years since the Dalin Tzu Chi Hospital has been established, and our most important goal is to safeguard life in the community. And seeing the living condition of the senior, it's clear she has a strong will to live.
Zhang Weiqiao, a first-year resident in the traditional Chinese medicine department, is participating in a medical outreach for the first time. Learning alongside the superintendent, she is seeing firsthand how Tzu Chi has long cared for patients in the forgotten corners of society.
It never occurred to me someone could live like this, lying on the bed each day, unable to move, and maybe not even eating 3 meals a day. It's not something I could have imagined before. The superintendent did remind me that coming to the medical outreach can increase my empathy towards patients in the future.
Having had surgery on his hip bone before, Wu Chen's husband has not been able to walk well for over 15 years. The husband has trouble going to the hospital, so the family is grateful for the care and house call.
I'm so glad for this. I'm just worried we are troubling so many people. His legs are the problem, but if you ask him, he says it doesn't hurt. However, he is unable to walk because it hurts him.
He's over 80 and has mobility issues, so he definitely needs Tima's type of service where doctors visit his home so they can see how much more they can help.
Dalin Tzu Chi Hospital is celebrating the 20th anniversary this year, and as always, the healthcare workers will continue to safeguard the community and keep everyone healthy.
Tima motivated 109 medical volunteers to conduct house calls in Yunlin. Among them was Hong Jinjia, an obstetrician and gynecologist who only recently joined Tima, but has participated in many free clinics. Another Tima doctor, Lin Rongsan, has 12 years of experience and hopes to bring medical care to those who really need it.
A member of Yunlin Tima, Dr. Li Rongsen, also serves as Deputy Superintendent of China Medical University Beigan Hospital. No matter how busy he is, he will never be absent from the house calls every year. Holding the patients tightly with both hands is his characteristics when conducting house calls, transmitting both warmth and strength to the patient with his palms.
Apart from doing our best to provide medical treatment with our profession, in fact, every patient's home is a good place for cultivation.
He doesn't leave patients alone, wanting to be a supporter and care provider. Hong Jinjia is an obstetrician and gynecologist. Dr. Hong recently joined Tima, though he has free clinic experience and helped many women give birth. His selfless dedication made him realize the Buddha's teaching of being self-sufficient to help others.
We need to care for the mind of the patient as well as his family members, how to help the patient adjust his mind, and for his family member to take care of him. It is indeed a manifestation of Dharma teachings.
House calls in Yunlin are divided into 13 routes. Tima vehicles drove through fields and alleys to arrive at the homes of the suffering who cannot go out for medical treatment. Some patients are unable to speak, while some are ashamed to express their feeling. Even though some of them cannot walk, they put their hands out the small window to say goodbye.
I always have hope. That is, if I have done anything wrong, I would hope a doctor will come soon.
They have come for more than 10 years, and it's very hard for them because they need to come no matter it's winter or summer.
The inspiration of a small group of Tima members has motivated a large group of volunteers, allowing the humanitarian health care to be more powerful.
On the 20th anniversary of Dalin Tzu Chi Hospital, Jen Rui Teng, the convener of Tima Yunlin Jiayi Tainan chapter, also superintendent of Dalin Tzu Chi Hospital, specially invited nearly 15 medical nurses and Tainan Tima volunteers to visit Nanhua District. Combining charity with medical treatment, they all united together as one to serve the people.
Wang Sentai is very happy to see this life-saving doctor. Because of 2 serious car accidents, his knees and lumbar spine were severely compressed, making him unable to walk. Referred by Tainan Timur, he went to Dalin Tzu Chi Hospital to undergo surgery so he can stand up again.
Last month, I heard that Superintendent Jian was coming. I'm very happy because he was the one who performed the surgery for me more than 2 years ago.
We come here regularly once a month and try to restore his muscle function as much as possible. After the treatment, he can ride a motorcycle to pick up his child.
Zhou Lizan, who is in the 4th year of residency, participated in a house course for the first time and took the opportunity to accumulate different medical experience.
This is my first time to join Tima's house calls. I think this is a very meaningful activity. Apart from helping these patients with their diseases, we can also give them spiritual support.
Every year, Dalin Tzu Chi Hospital celebrates its anniversary by hosting house calls. This year is the 20th anniversary of the hospital. We especially expanded the house calls to 25 routes. Before it was held in Yunlin, Jiai only. Today we especially came to Tainan, finally connecting Yunlin, Jiai, and Tainan together. Tzu Chi's humanitarian healthcare is actually a combination of charity and medical care, achieving the so-called comprehensive medical care, not just providing medical treatment to patients, but also comforting their hearts.
Apart from the route to the mountain, there is a route along the sea. Tima members go into every community to safeguard villagers' health. Having been spreading love and providing medical companionship for 20 years, Dalin Tzu Chi Hospital will continue to strive its best to serve patients.
Beginning in July, schools in Malaysia are resuming classes. Disinfection has started on campus, and schools are preparing for COVID prevention supplies for students. To help, Tzu Chi volunteers based in Selangor sent 20,000 handmade masks to 217 schools.
The Malaysian government announced the resuming of classes for all grades. Moreover, schools are experiencing high administrative costs due to the preparation process of reopening campuses.
Our school paid much of the cost already. Disinfection is in progress because we value our students the most. We also encourage teachers to prepare COVID prevention items for themselves.
Tzu Chi Kuala Lumpur and Selangor chapter volunteers donated masks to 217 schools.
Currently, we have sent around 20,000 masks to schools.
The masks are especially for teachers. When they teach, they could potentially be spreading the virus. Wearing the mask prevents the risk. We have an extra layer of protection wearing this mask.
What is touching about this is that these masks were handcrafted by our Tzu Chi brothers and sisters. It is heartwarming.
School officials gave the volunteers a commemorative medal to thank the handcrafted masks from Tzu Chi volunteers. Tzu Chi masks are given out with care and warmth, in hope that teachers may comfortably teach and students may safely learn.
The COVID-19 epidemic has slowed domestically and economic activity has restarted. However, we can't overlook the pressure faced by medical staff during this time. Research shows that the rates of depression and suicide in patients and medical staff will increase significantly, potentially long into the post-epidemic period. Take a look.
Layers of PPE are needed by medical staff who have to enter and exit the isolation ward 8 or 9 times a day.
I will go there in the morning to give care and treatment, and then at noon to help deliver meals, and then do after-meal treatment, and then take a temperature check before I get off work.
There are 23 negative pressure isolation wards in Jiai Changkeng Memorial Hospital. From January to May this year, 114 patients were suspected of having COVID-19, which kept medical staff very busy.
Medical staff actually work hard every day and have to wear a full set of protective equipment and be very careful.
The hospital was seeking a nurse who is dedicated to the isolation ward. I didn't really think much about being a nurse at a hospital in charge of isolation wards. I decided to voluntarily do it because I am very experienced and also very senior. As a health worker, we have to be at the front line.
Wang Jieru is a nurse with 25 years of experience. She's at the front line of epidemic prevention. Though she is brave, she dares not let her neighbors know about her work.
I think ordinary people still feel that the medical staff face a high risk of infection.
I think there is a degree of labeling in some communities. Medical personnel, including his family members, are not welcome to worry about their infection.
The stigma of medical staff is the weight they have to bear in saving the lives of patients. Lin Lengjie, director of the emergency department, almost used the hospital as his home during the epidemic. His body was exhausted, but his heart had to be strong for his wife and 2 children.
What kind of resettlement plan will be done by the family in case I am infected to go to quarantine? This plan has been arranged.
In fact, some COVID-19 cases may happen suddenly, and the entire ward was suddenly quarantined in the hospital. In fact, there are some colleagues who, because of this, had such a diagnosis.
Cases number 35, 36, 37, and 38 in Taiwan are all medical staff. They face the life and death issues that patients face every day.
We have seen a lot of Spanish, Italian, and US cases. Especially in New York, there has been hospital transmission, and the epidemic has gotten out of control. Some medical staff have even died, which has caused many great pain.
Medical staff face emotional stress due to their workload, which can cause an emotional or physical breakdown.
Medical researchers have found that moderate stress can improve workability, but once the pressure exceeds the critical value, performance begins to decrease and the error rate will increase.
It's easy to get nervous at work. I'm a very anxious person and I feel like I have a panic disorder. I'm really afraid that COVID-19 will spread to my family.
Medical staff are similar, and they are under tremendous pressure both physically and mentally.
It is a terrifying experience when people face the unknown, such as this virus. Many feel out of control when SARS hit 17 years ago, leading to the closure of Taipei Hoping Hospital, causing some people, such as medical staff, patients, or family members to be quarantined, leading to a major change.
We call this post-traumatic stress disorder, which can lead to shortness of breath, and some people are facing severe depression.
Research shows that people facing long-term quarantine, whether patients or medical staff, will have 3 emotional reactions: loss, responsibility, and conflict.
As soon as he was quarantined, he did not connect with his family for 14 days and was totally lost. It will affect his health and immunity of the whole body. Their roles and responsibility is no longer there, and this can have a big impact on a family. Some family members have no way to accompany them at the end of their life, which can be a great tragedy. A quarantined person staying in a small room for a long time will lead to no more conflict during times when they can have interaction.
The psychological trauma may be more serious than the actual infection. The heroes behind the slowing epidemic are the 310,000 medical staff who use their blood and sweat to prevent the epidemic from spreading. It is important for us to recognize their contributions, the threat of depression which many of them now face.